Hi, I'm Dr. Afzal, a very experienced, reputed anatomist from the city of Hyderabad, India, a master degree holder and a wide international experience in various medical colleges as a professor. Traveled world around with almost 18 years of my service having been in Ministry of Health jobs in the Middle East and Mauritius. Relocated here and been guiding medical and allied students online and in person on my conditions. Based on my expert knowledge and immense experience, I've always been an all-time student's favorite and highly regarded by the managements alike. I'm collaborating now in producing a question bank for physiotherapy students for competitive exams in their careers, making a collection of problem-based real-life situations to tackle by making the subject easier and understanding. Simpler explanation and with good reasoning. To be within your reach, I am available to assist you, guide and motivate you to success. I'm starting with a PPTX on histology, the microscopic anatomy, what the naked eye cannot see, and explaining the concepts, the knowledge and the same in a better basic way. I stress the fact that in this case explanation is just not the criteria, because a physical class cannot surprise in any of these modalities, and further encourage for a classwork presence and making my cause and purposeful more meaningful. And here is the PPT, you please go through it. As I said, histology, it is the microscopic anatomy, what the naked eye cannot see. So I'm dealing here with muscle, bone and skin. As you all know, histology is the study of a given tissue under the magnification of a microscope, knowing the finer details of its structure, what the naked eye cannot see. I'll start first with the muscle tissue. This group of cells called myocytes forming the muscle tissue is composed of cells characterized by its contractility, excitability, extensibility and elasticity properties, enabling it to respond to a stimulus by shortening, stretching and regaining its shape back. This is based on the presence of contractile proteins actin and myosin. It can be voluntary, involuntary, striated, non-striated. Muscle tissue include skeletal muscle, cardiac muscle, smooth muscle, made up of thousands of fibers woven together. Individual muscle cells like myoepithelial and myofibroblast also exist in glandular structures and in tissues respectively. Skeletal muscle fibers are long, cylindrical, striated and multinucleated, attached to the body skeleton, being voluntary, fast and powerful, used for bodily movements and posture. They can be slow twitch, that is type 1, and fast twitch or type 2 types, and the third variety is the cardiac muscle fibers, which are short, cylindrical, single, nucleated, involuntary and rhythmic in nature, and strong, interconnected by the characteristic intercalated discs composing the heart wall. Smooth muscle fibers are involuntary, spindle-shaped, single-nucleated, slow and sustained contraction, forming sheets over the organs and vessels used for propelling forward the contents by the single and multi-unit type of nerve supply. I'm starting with MCQs. A 45-year-old subject reports at a medical center with history of progressive and continuous diminishing body muscle power, weakness and shrinking muscle mass. He is advised muscle biopsy. What type of muscle pathology is likely occurring in this case? Here I have highlighted the answer, the C being the answer, that is atrophy, which means the muscle shrinks, and that is the reason. Question number 2. An athlete taking part in a race abandons his attempt midway with hamstring strain. Which of these fibers are likely affected? The answer is again highlighted here. It is type 2 fast twitch fibers. Third, a painter reports at a medical center with sudden difficulty in breathing following inhalation of irritant vapors. Which muscle fibers in this respiratory tract are likely affected? The third question answer being the smooth muscle fibers, which is highlighted here again. Question number 4. A young female subject with normal hormonal level is diagnosed with defective mammary secretions. Which muscle cell can be the likely culprit in these glands? Answer is the B, myoepithelial individual cells, which are the main source of contraction, thereby draining the glandular structures. Coming to the bone, we all know that bone is a specialized connective tissue wherein the intercellular matrix gets deposited with proteoglycans. That is, cartilage has firm and flexible properties, or if it is getting deposited with calcium like bone, which forms firm and hard tissue, forming the skeletal structure of the human body. Bones are responsible for somatic rigidity, structural outline, erect posture, and movements, forming the segmented levers for convenient movements, and are 206 in an average adult. They are further classified by shape into long, short, flat, irregular, pneumatic, and sesamoid varieties. They are developed by two basic methods: intramembranous formation and endochondral formation. And at birth, most of them are in a cartilaginous form. Microscopically, they are categorized into woven, which means haphazard collagen arrangement, or lamellar, which is highly organized parallel fiber structure, forming the compact and spongy bones. The former is immature, mechanically weak, found during development and fracture repair, but the later is mechanically strong, layered structure of collagen, making most of the bone in healthy adult. Compact bone forms a hard, dense outer collar for strength and protection, whereas the spongy type, also called as cancellous bone, is porous, honeycomb-like structure, making the bone lighter, giving strength against compression, and contain the red bone marrow. The cell varieties for bone formation are osteoprogenitor cells, osteoblast, mature osteocytes, but the bone cell that remodels it are the osteoclast, because these cells are mainly responsible for bringing a final shape to a given bone. Compact bone is organized as osteon Haversian system, spongy, a latticework trabeculae. The MCQs on this topic: the first one, the X-ray of a stress fracture of a 65-year-old lady will show which type of bone tissue in her follow-up visit for a week. Answer is woven bone. Question number 2. A 70-year-old male subject with osteoporotic fragility fracture in his X-ray will show which of these? Highlighted answer being C, that is reduced bone density mass. Question number 3. A case of bone tumor diagnosed as osteosarcoma presenting in the orthopedic department undergoing a follow-up. The X-ray will show. The answer is C, immature bone cells with abnormal mitosis. Question number 4. The metaphysis area known for osteomyelitis is showing a growth like sequestrum formation. What tissue is expected to be seen here? The answer, which is highlighted again, is C, a bone fragment separated out being the culprit. Coming to the third of this, the skin tissue, which is forming the largest organ of the human body. It is the outermost covering of the body forming the largest organ system with multiple functions. It brings grace on the skeletal framework of the body surrounded by muscles. It is divided into a superficial epidermis, dermoepidermal junction thrown into folds, and a deeper dermis. The skin and its appendages forms the integumentary system. Skin is of two types basically, thin skin and thick skin. The thin skin is avascular with 5 layers composing it, and the deeper dermis has 2 layers, papillary and reticular layers. The appendages are hair, nails, and the glands. The basal layer of the epidermis, which is forming the 5th layer, is concerned with regeneration, and the papillae at the dermoepidermal junction, giving the legal skin patterns, which is gone by the name of dermatoglyphics, that is the fingerprinting. The MCQs related to this topic, the question number 1, a subject exposed to a deep burn injury is left with denuded surface. What is the reason a skin graft is required here? The answer is again highlighted here, being A, the loss of basal germinal layer of epidermis, which is primarily responsible for any regeneration capacity of the skin. Question number 2, a 40-year-old subject with history of old severe scald injury has reported with skin graft failure based on inadequate vascularity. What microscopic structure is expected in the graft tissue? The answer is again highlighted here, is number C, less vascular ingrowth is the reason. Question number 3, a 35-year-old case with scaly erythematous plaques of psoriasis. Skin tag shows which of the following histological aspects? The answer highlighted here being C, both of the above features, which means high epidermal thickness and high proliferation of keratinocytes. Question number 4, a known diabetic case presenting with a resistant food ulcer. What microscopic picture is expected from the wound scar tissue? The answer again highlighted here being D, hypertrophied condition is the culprit here.